I'm Dr. Beth Kasanoff-Piper, President of the Dallas County Medical Society. The CDC recently unanimously approved giving kids ages 5 to 11 the Pfizer COVID-19 vaccine. This means that now 28 million children in the United States can now be vaccinated. Kids commonly get COVID-19 and can spread it to others. Kids are less likely than adults to have severe COVID, but the spread of the Delta variant triggered a surge in cases this summer, during which hospitalizations among children and adolescents increased over 400%. Kids who get COVID are at risk for multisystem inflammatory syndrome, which is a complication of COVID that causes inflammation of multiple different organs, including the heart, lungs, kidneys, brain, stomach, and eyes. It can be life-threatening. Many kids have also experienced long COVID symptoms, which can last for months and interfere with regular activities, such as sports and school. Information from the CDC shows that about 1/3 of the kids hospitalized for COVID illness had no prior medical conditions at all that would have increased their risk. In the clinical trials, the vaccine was 91% effective at preventing COVID in this group. The trial included healthy children as well as kids with underlying health problems like asthma, cystic fibrosis, congenital heart disease, or sickle cell disease. Vaccination is especially important for kids who are immunocompromised in any way. Side effects from the vaccine were mild, most commonly a sore arm at the injection site and some fatigue or headache or muscle pains that resolved quickly. There were no reports of serious complications such as myocarditis in the study. Just like the shots for adults, there will be 2 shots required with at least 21 days between injections. The dose for children is a smaller dose, about 1/3 of the amount of an adult dose. The pediatric doses come in separate vials and are not interchangeable with the adult doses. It's important to note that the size or weight of the child does not affect what dose should be given. All kids between 5 and 11 should be given the same dose because that dose gives the same level of antibody response that young adults had from their adult dose. The CDC still recommends that children with a history of COVID get both the vaccines to provide them long-lasting protection. The vaccine has been shipped to many pharmacies, pediatricians, health clinics, and hospitals, and more to come soon. The Texas Pediatric Society and the American Academy of Pediatrics have both recommended that children get the vaccine. If you have questions about the pediatric vaccine or not sure if your child should get it, talk to your child's doctor. They'll be able to guide you with the correct information. People ask me, okay, what if my child already had COVID? We do recommend vaccination for kids who've already had COVID. Kids get some natural immunity after a COVID infection, but we don't know how long that lasts, and we've seen people get COVID more than once since the start of the pandemic. The kids can get vaccinated as soon as they feel better from their COVID illness. Another question is, what if my child gets vaccinated? Could they shed virus to their classmates or siblings? And this is not possible, thankfully, because there are no live viruses used in the COVID-19 vaccine. Okay, what if my child is 11 now but turns 12 soon? Should I wait to get them the higher dose? What if he's a big kid for his age? Does that affect things? Vaccines are not like medicines, which are often dosed based on age. The lower vaccine was very effective in producing antibodies in kids anywhere between 5 and 11. If your child turns 12 between the first and second shots, they'll get the higher dose for 12-year-olds for their second dose. Pfizer is the only vaccine currently approved for children and adolescents. And Pfizer is currently conducting trials for kids ages 6 months to 2 years and ages 2 to 5 years. Information from these studies is expected early next year. Moderna is expected to submit its data to the FDA for use in adolescents and children soon. Having our children vaccinated will help protect them from getting COVID and reduce their risk of severe disease and long-term COVID complications, and help curb community transmission and reduce the likelihood that they will need to miss school or other important events and activities. So far in the United States, in the last 2 weeks, 2.6 million kids have received their first shot. Let's keep it up.